Hello, I'm Eva Bove, and today I'm going to be going over evidence-based strategies for strength and conditioning in female 100-meter sprinters at the Olympic level. So the 100-meter sprint requires both maximal neuromuscular power and refined technical execution across start, acceleration, and top speed phases. The purpose of this presentation is not simply to outline exercises, but to critically inform coaches on tools, research findings, and strategies that optimize sprint performance and reduce injury. Presentation is going to be structured to first analyze physical demands, moving into key performance indicators or KPIs, normative data and what that looks like, common limitations and injuries, relevant info for success, macro cycles. So in this example, we're going to be going over the single peak model as that aligns most with outdoor sprinting. And then we're going to be going over exercise examples and training strategies for coaches. So moving into the physical demands. Sprinters are going to have to generate maximal. So moving into physical demands, sprinters must generate maximal horizontal force during their first steps and then maintain high vertical impulses at top speed. Contact times are extremely short, demanding rapid force application and high neuromuscular efficiency. Training strategies must therefore target rate of force development, horizontal force application, and reactive strength, reflecting the unique biomechanical and physiological demands of the 100-meter sprint. Energy contribution, or the systems of energy that are used, is predominantly the phosphagen system with anaerobic glycolysis as well. So high intensity, short duration, and fully recovered efforts are ideal for conditioning and training. Moving into key performance indicators, or KPIs, the most common ones are going to be acceleration, velocity max, force velocity profiling, which does involve velocity max, explosive power like the CMJ or counter movement jump and horizontal jump, and then eccentric hamstring strength and asymmetry. The KPIs here both reflect mechanical output and physiological readiness. Early acceleration is quantified by short splits, so meaning 0 to 5 meters and 0 to 10 meter phase. So again, that takeoff, because Olympic sprinting requires blocks, as most do. And then maximal velocity is assessed via the 30-60 to 60-100 meter splits. Force velocity profiling informs whether an athlete is limited by force or velocity more. This is really helpful for targeted interventions. Explosive power tests like the counter movement jump and horizontal jumps monitor neuromuscular capacity, and then eccentric hamstring measures help prevent the most common sprint injuries, which we're going to be talking about next. Tracking these KPIs repeatedly is going to allow individualized programming and optimization of sprint-specific strength, power, and again, injury prevention. Tracking is one of the most important things when dealing with athletes at any level, especially the elite level. Moving into normative data, these values are going to be providing benchmarks, basically, for performance evaluation and training goal setting. They're going to be allowing coaches to assess gaps between current ability and the standards, for this instance, elite standards. For instance, the early acceleration or horizontal force output below collegiate norms identifies a need for targeted strength and resistance sprint interventions if you're dealing with collegiate athletes. These metrics are critical for planning not only individualized but also group cycles and predicting the potentials for improvement. So let's take a look at some. Here you can see comparable split times for women and men across different phases at the Olympic level. And you can see that this table 1 shows men's and women's. We're going to be looking specifically at women's, but this is going to be the top speed. So from 30 meters to 100 meters is shown in the chart. Anything before 30 meters is generally considered the acceleration phase, as discussed prior. And then in this is an abstract from another study that you can find in the references. This is going to be helpful in identifying some of the discrepancies between data shown, which is also important to know when you're making programs, what data you're using, because a lot of references will identify different KPIs, but not the discrepancies between the genders between the two. So that's just something to know whether you're training male or female athletes. But in this case of female Olympic sprinting, the variables such as acceleration are gender specific, and then non-significantly varying variables include step rate. Sorry, technical difficulties. So common limitations and injuries. Moving here, the hamstring strains are the most frequent sprint injuries, often occurring when moving into the terminal swing when eccentric loads are highest. Other common injuries include Achilles injuries and patellofemoral pain, often due to training load mismanagement. Female athletes are at a higher risk for ACL injuries due to pelvic geometry, hormonal influences, which vary per person, and imbalances can happen in men, but it's not as normal or frequent, and neuromuscular control deficits. So chronic mobility restrictions like limited hip extension or ankle dorsiflexion can also impair force application and sprint mechanics, of course. Tight hip flexors not only make strides less powerful, but also inhibit the extensors by placing them in a more lengthened position, which may or may not be associated with anterior pelvic tilt. Injury prevention through eccentric hamstring training, Nordic progressions, and neuromuscular control drills throughout the entire body is crucial for maintaining high training loads and performance continuity. Moving into some relevant information for success, we have to know that if we want success in something and want to get better at something, we must get better at the adaptations that are specific to those demands. This is the concept that is applied in the SAID principle, which stands for specific adaptations to impose demand. This is something that is important across all sports and all fields generally, but of course that includes sprinting. The success in the 100-meter sprinting relies on producing large horizontal forces during acceleration and efficiently tolerating high-frequency, high-magnitude forces at velocity max. Strength training should not only build absolute force, but also convert it into rapid force production through ballistic and sprint-specific exercises, improving the rate of force development, which is one of the neuromuscular adaptations attained. Eccentric hamstring work and stiffness training enhance both performance and injury resilience. Programmed correctly, all these elements combined optimize sprint mechanics while safeguarding the athlete's health and again reducing that risk of injury, which is so important. Now we're going to take a look at the single peak model, which is a simple macro cycle that aligns with Olympic outdoor competition and is peer-reviewed and empirically researched supported. So the general prep phase, or the GPP, emphasizes hypertrophy and maximal strength to increase the athlete's force potential, with focuses on baseline mobility, stability, power, strength, again, correcting asymmetries, technique, and movement competency overall, sprint specific in this case. During the competition phase, training volume drops, but intensity remains high, focusing on sprint mechanics and neuromuscular efficiency. The transition phase then allows active recovery and foundational maintenance. Across all phases, it's important to keep neuromuscular demands high in order to maintain adaptations. The sequencing of the single peak model here respects the SAID principle and ensures adaptations transfer to sprint performance, according to Townsend et al. And Moreno and Zaminzo in 2016. Now on screen is an example of a workout in the general preparation phase, where focusing on strength and gradually more power work, hypertrophy work, and maximal strength work development through high volume, moderate to heavy intensity training. So you can see here that athletes perform compound movements with 3 to 5 sets of 6 to 12 repetitions at 70 to 85% of maximal effort. Towards the second half of this phase, which can sometimes be referred to as the specific preparation phase, which is included in the GPP here, is when the training load shifts to 2 to 4 sets of 1 to 5 repetitions at 85 to 95% intensity, which emphasizes the rate of force development, again, which is crucial for all the neuromuscular adaptations that we want to achieve in sprinting. So moving into the competition phase considerations, decreased volume, tapering, and maintaining high intensity for those neuromuscular adaptations is important here. Strength work as maintenance, so 1 to 2 sessions of 85 to 90% intensity per week. Athletes dramatically reduce training volume, again, as stated, while maintaining intensity, allowing for complete recovery and then supercompensation once in competition. This tapering process typically reduces training loads by 50 to 80% in the final weeks before major competitions. This phase also brings the elements of longer strides attained during strength phases and higher frequencies of strides attained during speed phases together for optimal performance. Moving into the considerations in the transition phase, the primary focus shifts from active recovery, injury prevention, and mental restoration here. Athletes will engage in low-intensity activities like swimming, cycling, recreational sports, and general fitness activities that maintain basic conditioning and still demanding intensities, but generally lower stress. This is the shortest period and happens after the competition competitive period. So as a college sport performance coach, I would begin by assessing KPIs to identify athlete-specific deficits and tracking that throughout the phases. Training would follow a strength to power to speed progression, emphasizing rate of force development and transfer and sprint mechanics, following principles of progression, specificity and overload is key here. So load monitoring ensures fatigue management and reduces injury risk, especially in preventing overtraining syndrome, which we don't want, no one wants. So preventative exercises like eccentric hamstring work, plyos, and mobility drills are incorporated across all phases, not only during the GPP, along with a high nervous system output, again, across phases, ensuring local and global adaptations are achieved, maintained, and improved. This evidence-based approach maximizes performance while protecting athletes from overuse and reducing the risk or likelihood of injuries. So, in summary, an elite 100-meter sprint requires training that directly targets the qualities that actually predict success. Things like rate of force development, horizontal force production, stiffness, hip flexor speed, hamstring strength at different lengths, stretch shortening cycle use, and many others form the foundation of acceleration and max velocity mechanics with strength, power, and speed integrated. By using these KPIs mentioned to guide programming, we're able to create training cycles that are actually intentional and useful. Periodization through a phased macro cycle, like the single peak model that we discussed, shows and supports optimal results in evidence. And when we combine Olympic derivatives, plyos, contrast training, angle-specific strength, all of these, we address every phase of the sprint. So at the end of the day, implementing training to prevent injury is not optional. Following the principles and goals of desired neuromuscular adaptations discussed produce athletes who are not only faster and quicker, but are also more resilient across a full season. Here are the references, and that concludes this presentation. You can see the description for the link to the continuing education unit quiz and ATP. Thank you.